Question, Baroness Pitkeathley.
I beg leave to put the question standing in my name on the order paper.
My Lords, the Government introduced changes to the visa requirements for how carers can be recruited to the UK on the 11th of March. The Home Office worked together with the Department for Health and Social Care to implement these measures. We will continue to keep all visa routes under review and will consider changes where appropriate.
I'm sure the Minister will agree that the already beleaguered and inadequate social care workforce needs extra people, and until we're able to recruit and train them here, they must be found from overseas. But there have been multiple failures identified in the Home Office system for awarding care worker visas. They've underestimated demand by a large degree. They applied an inappropriate scheme in a very high-risk area, and they have nothing like enough staff to regulate licensed sponsors or to process applications. As they review this policy, will the Minister commit the Government to working with the social care sector, who is very knowledgeable about these issues, to rectify these problems and to ensure that there's a sufficient supply of care workers to meet the ever-growing demand?
Well, can I first say to the noble lady that the Home Office seemed to bear the brunt of her accusations there, but this was a cross-government exercise involving the Department of Health, the Treasury, Number 10, the Cabinet Office and other departments. The fact is that the most recent published statistics relate to the year ending of December 2023 and show that we have issued more than 146,000 visas for the health and care visa. My Lords, to suggest that we're not supporting the sector would be inaccurate. We are, including on things like how to register good applications, explaining the rules around genuine vacancies, and addressing the mismatch between the actual job and salary and not things like anticipated demand. There's a lot of work going on.
There are accounts of care workers coming to the UK being exploited as either the jobs don't exist as advertised or they find themselves in hock to middlemen. Would the noble Lord the Minister agree that people who come here and apply for these visas in good faith should be treated with compassion? And can he explain how many people the Home Office has employed to help those people by going after fraudulent sponsors and exploitative agents?
Well, the noble lord is of course right in that there has been some abuse of the system, which is readily acknowledged by the sector itself. I noticed on the Skills for Care website they point out that this system has been open to abuse in the past, and they provide some helpful links to some of the stories about modern slavery. Of course, the government in general will not tolerate illegal activity in the labour market. Any accusations of illegal employment practices will be thoroughly investigated, and we strongly condemn offering health and care worker visa holders employment under false pretences, which of course partly motivates these changes.
The charity Unseen and Unison, the union, have compiled substantial evidence of the exploitation of some of these workers who now find themselves in limbo because they have been hired by agencies which don't have enough hours for them and they're not allowed to switch to any other profession. Will the Minister undertake to look at what quality control the Care Quality Commission uses when it licensed a very large number of new providers last year into the market, which is already saturated with providers? Have they looked at the churn in the number of providers and how many of those providers have already closed? And what steps can they take to stop these fraudulent recruitment agencies operating in other countries, which are fundamentally misleading good people who wanted to come to our country and have been sorely missold?
Good. It's about the activities that have taken place in some other countries, and of course our abilities to actually influence those are somewhat constrained. What I would say, however, is that with regards to the Care Quality Commission, I don't actually know how they go about licensing. I will find out and I will report back to the noble lady on that. But as I'll repeat my previous answer, we are of course going to go after all of those who are engaged in fraudulent practices.
Would the noble Lord the Minister agree on reflection that preventative measures should have been put in place? Many unions and organisations are now arguing that no business should be able to sponsor care workers unless they've been in operation for at least 2 years and unless they've had an inspection first rather than after the event? And secondly, that how are we going to go after abuses in the labour market when there are so few inspectors? For example, 18 inspectors supposed to deal with an agency sector covering 40,000 businesses.
I can't comment on the number of inspectors because I genuinely don't know the answer to how many there are. But I do take the noble lady's points, of course. And as I say, I reiterate the point that we will go after people who are abusing both the visas and indeed the individuals in there. And we should remember that the employers also need to be supported to recruit staff from abroad in a way that meets the needs of those people. That's a point that's made by the Skills for Care organisation, and I completely agree.
The work of care workers is extremely valued, particularly by those who are dependent upon them for their daily living. And this extends across the whole age range of the population and extends to not only in residential establishments but in home care facilities. My Lords, underlying all of this is one of the difficulties that whilst this care work is highly valued, it is a low-paid occupation, and I hope the government will give thought to a way in which we can improve the status of care workers and thereby their earning potential in this country.
Well, I would very much agree with the noble lord that the care workers themselves need all of our support and indeed our praise for the very important work and very necessary work that they all do. But I would say that, of course, care workers are not subject to the same salary cap as other workers. So applicants to the health and care visa are exempted from the new £38,700 salary threshold. They must be paid at least £23,200 per annum. So the system as constructed does take into account the relatively low-paid nature of this work.
My Lords, following on from Lord Laming's very good question, do we not have a moral duty and a responsibility in terms of public policy, not just to import the best people from abroad, but given that we have record numbers of people on out-of-work benefits, to give opportunities and training and skills to our own young people who would benefit very much from that and enhance that particular industry, rather than continually looking to foreign nationals to come in and do the jobs that British people could be trained to do.
With my noble friend on that, and of course we remain committed to developing the domestic workforce. We're doing that by investing in retention. There is a high churn rate in this sector, as is well understood. That's through better workforce training, recognition and career progression. There's a new career structure being launched for care workers so that all staff can build their careers and more experienced care workers are recognised for their skills. We're creating new qualifications and a digital skills record to reduce the need for retraining costs. We're increasing funding for learning and development. The government's made up to £8.6 billion in additional funding over the financial years 2023-24 and 24-25 to support adult social care and discharge. So I trust that all noble lords will support the PM's valiant efforts to mobilise those who are not currently engaged with the domestic workforce.
My Lords, the noble Lord the Minister spoke of fraudulent sponsors and exploitative agents. Can I ask the Minister what assessment the government has made of the need to tighten up repayment clauses for relocation and visa costs, and requiring compliance with Department of Health and Social Care rules on international recruitment as a condition of gaining a sponsor licence?
Well, the noble lord develops on a theme that was explored earlier in a question that I couldn't entirely answer, but I will come back to him with a better answer in due course.
Given that the noble lord has in effect embedded the idea of social care work being low paid in the answer he gave earlier about the salary caps in relation to visas, can he say whether he thinks that £23,500 is an adequate reflection of the real value that any individual care worker provides through their work?
I say to the noble lady, I didn't embed anything. I was just restating what is actually a fact. Whether or not I think it's the right number for the sorts of work that's done, obviously there is a considerable variety of the type of care that is given, so I don't think it would be appropriate to really comment on the number in its totality.
I'm sure the Minister will feel at the end of this that anyone listening to the totality of this question will see that there are very serious issues in that the government has failed to address the whole issue of social care. It is a sector that is failing the country at a time we know there needs to be a lot more, because as we see around us, we're all getting older and we're living longer and need more care. The government have now had 14 more and more years. When are they actually going to address the sector as a whole and reform it?
The Noble Lady asks me about the care sector in general. I'm obviously here to talk about visas. And what I will say about visas is the government has, in fact, clamped down on the abuse of the visa system. And once again, it is endeavouring to protect the integrity of our borders. And I'm sure the Noble Lady would welcome that.